Hi, this is Dr. Paul Spano, again from the World Congress of Hair Restoration in Bangkok 2019, and I'm here with Dr. R.Nathan from KL. He's arguably KL's not only best dermatologist who does hair restoration, but probably best looking dermatologist who does hair restoration as well. Yeah, there is no argument.
Arguably bit, but anyway, carry on.
And he doesn't do a bad Australian accent, by the way. How are you enjoying the conference, Ruben?
Oh, brilliant, man. It's great to be here. It's great to be out of the clinic, my clinic.
Yes.
It's great to meet all these colleagues and talk about what we do.
Yes.
It's like group therapy, isn't it?
Absolutely. Now, just for people watching, what do you think it takes to be a great hair transplant surgeon?
For me, I would say the ability to say no to a patient shows that you're not profit driven and that you really care. And some patients think that hair transplant is the panacea and the only thing that works. So you have to have other tools to help the individual. It's not just hair transplant.
Yes.
And a lot of patients come too young and still think that this is the thing. So it's the philosophy to long-term plan. So you're planning for the patient till the end of his or her days.
I agree totally. Yeah. And I think some of the kind of like the franchised clinics that happen all around the world, they just want to do a transplant and get patients' money. They're not in for treating that person and their hair loss needs for their whole life. That's a fantastic point. What about the role of your assistant staff? So one person can't do an entire transplant by themselves. I think, how important for you is it to have great staff around you?
Well, yeah, of course. We do the planning, we do the consultation, we extract the grafts, we create the sites, we plan, but manhandling a single graft can define, negatively a patient's future. So that person manipulating that graft, your staff, is so important.
Yes.
So no matter how brilliant you think your skill is, the skill of your staff is the thing that determines the end result. So yeah, of course, we're entirely beholden to them and their techniques to create the successful outcome. That's so important.
Can I grab a quick comment from you about the FUE versus FUT scenario? Now, I know it's a very big topic, but what pops into your head when I say, how do you decide between FUT and FUE?
Well, it's cultural, isn't it? I've trained and observed clinics in other places, so apparently in Korea, and this situation may change, but the average Korean man is abhorrent to the idea of shaving his scalp. So a complete hair transplant physician should be able to do both, depending on a patient's needs.
Yes.
The patient wants to rush to a business meeting that same week and doesn't want to look altered, then FUT would be ideal.
Yes.
This donor area you can conceal and easily and etc. etc. So again, donor densities and etc. Might determine your choice of procedure.
Sure.
If you want to preserve the rest of the donor density, then maybe FUT in a slightly younger patient may be a better way to go.
Yes.
So yeah, you need both.
So I think great comment. The point is that your hair restoration surgeon should be able to offer you both techniques and know both techniques very well so that they can help the patient make the best decision for them.
Which means old folks like us are still in business.
That's right, exactly.
It's usually the more senior hair transplant dudes that are able to do both.
Because there's so many new kind of pop-up clinics that just do FUE and pretend it's the one all and for the patient. Of course, it's absolutely, when you really know about hair transplant surgery, been doing it for as long as you and I have, you know that's not the case. So if you're happening to go through KL and you need have some skin work or a hair transplant, Dr. R.Nathan's you're definitely your man.
Happy to help.
Great to chat with you, and always a pleasure to see you.
Good to see you, man.
Terrific.
Take care. All right.